The Denver Hospice is known for providing compassionate care for hospice patients and their families in the Denver area. But since 2001, the Denver Hospice has also had a partnership with a hospice program in northern Tanzania in eastern Africa. Selian Lutheran Hospice Program in Arusha, Tanzania has been serving patients and their family since 1999. At that time, the AIDS pandemic was raging, and antiretroviral drugs were not available. The program grew quickly from 3 patients to many hundreds of patients, and even though no narcotics were available, Selian visits provided comfort to the patients. Morphine is usually available now, as are the first-line AIDS drugs. The Selian model is very cost-effective. Very few paid staff supervise many well-trained volunteers who provide most of the day-to-day care. Day clinics are held at monthly rotating sites in order to reach more patients. At day clinics, 30 to 50 patients gather for the day. They receive medical evaluations, pastoral care and social support, medications, and food staples if they are available. The Orphan and Vulnerable Children's Program meets in tandem with the day clinics. Children receive a meal, medications and consultation, and just the chance to have some fun. Some of the highlights of our partnership include raising money for several four-wheel drive vehicles because the roads are rough in Tanzania. We raised money to build an office with a training center for training volunteers and other palliative care workers in Tanzania. We provided support and training for bereavement services, including bereavement support groups. We provided support and training and extra funding for pediatric hospice care and support to orphans and vulnerable children. In 2006, we helped Selian to receive a grant from USAID, the Agency for International Development. With that support, Selian was able to expand to its peak in 2015 when they were serving over 5,500 patients. But USAID has faced budget cuts to its palliative care programs, and so as of January 1st, 2017, USAID is no longer funding Selian. Staff, patients, and volunteers have all been cut as a result. But we are committed to keeping their program going by raising money to support their core services. Since the beginning, our hospice partnership has been a two-way exchange of ideas as well as financial support. There are so many good causes to support in the world, but this is one where we have a relationship of trust built over many years. We may not be able to solve the problem of clean drinking water or developing a vaccine, but hospice is what we do. It's what we know, and that's why we have chosen to partner with Selian Hospice. Even though most of the patients with HIV are now surviving longer, poor nutrition and lack of access to health care make AIDS much more deadly in Tanzania than in the U.S. In addition, cancer is on the rise in Tanzania, and cancer screening and treatment are almost non-existent in most of Tanzania. Selian Hospice Program needs us now more than ever, to be a bridge until the time when the Tanzanian Health Ministry or another funding source can take over funding again. Please help us to continue our partnership with Selian Hospice.
La 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 la.